The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, or good afternoon, depending on where you're logging in from. Welcome to HIPAA and HITECH, Understanding the Final Omnibus Rule. I'm Angie Yazilitis, and I'll be your facilitator for today's webinar. A few housekeeping items as we get started. Just a minute here. Sorry, we wanted to make sure that the slides were coming up. A few housekeeping items. We've put together a more conversational-based question and answer approach to today's topic because we know that this can be an overwhelming topic. What we're going to do is try to allow at least 10 minutes for questions at the end of the presentation. However, if you want, you can go ahead and use the chat feature to send questions over during the presentation. Now, if I view them and I feel it's appropriate, we may choose to address those questions during the presentation, or we'll just wait till the end of the call. We're excited to be joined today by some of the wonderful panelists that you see on the screen. Of course, our featured panelist is Angie Singer-Keating, who comes to us with a wealth of expertise in this topic, and I'll be introducing her in just a few moments. And I'm very excited to have some of our RadSite experts joining us, our Director of Accreditation for RadSite, Dr. Bruce Reiner, and Junelle Anise, who is also our Director of Operations, are going to be giving us a little bit of insight in terms of the radiology industry towards the end of the discussion today. I want to give you a little bit of history on RadSite as we get started. Of course, RadSite was founded in 2005, and it was a subsidiary of Health Help. Many of you may be familiar with Health Help. Our primary goal at RadSite is to promote integrity, transparency, and accountability in the radiology industry and in everything that we do. We are very fortunate as an organization because we have a wide array of experts that help run our committee system, which develops the standards in promoting quality and safety in medical imaging. So whether you're in the radiology field or not, our focus and the focus of this webinar today is to promote and support the patient safety mission. RadSite is committed to building evidence-based processes and measurements that are integrated into all of our quality programs. And we're very proud of our committee structure because it provides an important third-party peer review system that really ensures a best-in-class operation. So what we're known for is we are an assessment, certification, and auditing body for the imaging industry, and we work directly with both providers and payers. One of the core components to RadSite is that all RadSite certified and accredited organizations also have to agree to be audited on-site, whether they're selected randomly or whether they're audited through something that comes out of their assessment with RadSite. We also focus on a relationship and education-centered model, and so what we're doing today in terms of education is very important to us. We want our partners, our clients, our providers, our payers to really understand changes in the industry, and certainly the Omnibus Rule is providing some changes that need to be addressed for anybody that's working in the healthcare industry. So when we assess or certify a provider, we focus on three key areas: personnel requirements, appropriateness of equipment, and imaging policies. And really that's where this HIPAA and HITECH component fits in, is within the imaging policies. So regardless of whether you're a payer or a provider today, you always want to consider the HIPAA and HITECH within your personnel requirements, within your training, and certainly within your policies and your procedures. We're going to go ahead and get to the heart of this and talk a little bit about our presenter today, Angie Keating. Angie Singer-Keating is the CEO and the co-founder of Reclamere. Reclamere is an organization centered around data security. They're data security experts. Angie comes to us with a wealth of certifications and affiliations, which you can see on the screen, one of which is the Certified Information Privacy Professional, which is by the International Association of Privacy Professionals. So she really gets and understands this material and how to partner with you to help you process all of the changes. Angie has 20 years of professional experience in this industry and has spent the past 10 years really specializing in computer forensics, data recovery, data destruction, certainly security, incident response, system auditing. She also provides consulting and training to the wide gamut of components that fall within this HIPAA and high-tech world. So to various industries, not just healthcare, certainly healthcare, legal, financial services, banking, insurance, government, and even higher education. Angie actually manages a team of data security experts, and on her team, they bring 75 years of combined expertise in many complex projects and litigations. So you understand that she's bringing that experience to this webinar, and what we want to focus on certainly is there's a lot of content today, but the fact that we will be here after to provide some follow-up, and we want you to feel free to reach out to us and to use that expertise. Most of you know what HIPAA and high-tech is. Certainly HIPAA was passed in 1996, and it is all about the protection and confidential handling of protected health information, PHI, and the Health Information Technology for Economic and Clinical Health Act came in place in 2009, and it goes to the component of the adoption and meaningful use of health information technology, which is certainly part of all of our worlds today and within the industry for sure. The interesting thing about what's happening within HIPAA and high-tech, and certainly the Omnibus rule, and you can see on your slide, is that there are over 99 pages to the Omnibus rule, over 33,000 words. There's 82 standards within it, and there's 169 audit key standards within the Omnibus rule. So, making sure that you have adopted everything, that you have your best practices in place is certainly a concern for a lot of people. And so we want you to be able to take a deep breath and understand that it can be overwhelming, and we're here to help you. What we've done is we've broken it down into the core changes. So the core changes really have to do with breach, privacy, notification, and then the enforcement of the Omnibus rule. And within that, one of the core components also is for those of us who work with business associates. So we're going to be talking today a lot about covered entities and their business associates, because that's one of the key changes within the Omnibus rule. It's okay to recognize that HIPAA and high-tech will impact your workflow, but it doesn't have to impact productivity in a negative manner. And I think that's something that we all look at with this, is we have to make changes, but we still have to keep our businesses running, and we still have to focus on our patients, our members. What we want to get to the heart of today is that by selecting the correct IT partners within your organization and vendors, you can actually eliminate all of the lost future productivity. And that idea is really to have workflow neutrality. That really means that there's no ongoing negative impact on workflow and the best patient experience that you want to provide. If you pick the correct partners and you focus on vendor selection, you can actually really not have to worry about that workflow neutrality. There's an interesting quote, and the reason we have patient and member safety and satisfaction on there, because I think a lot of us believe that that sort of that the patient or the member doesn't necessarily worry about this as much as we think they might. It's very interesting. According to an article which is entitled How the Public Views Privacy and Health Research, a majority of Americans only feel their healthcare providers somewhat protect the privacy of their healthcare information. And nearly 60% feel their health information is not adequately protected. So, you know, when you think about that and you think about what's going on in healthcare today, ensuring that you really have done what you need to do and you can be confident with the changes in the Omnibus rule is a differentiator in the industry. Your patients, your members do care about this. And with all of the different articles and information that's going out on the Omnibus rule changes, a lot of them are also aware of what's going on. With that, we really want to start and bring in Angie, focusing on business associates and subcontractors, because this really is one of the largest changes in the Omnibus rule. Angie, when most of us, when we've in the past, as a covered entity, we've done everything we can to ensure within our own organizations. Can you talk about what's changing in terms of business associates needing to comply now at a higher level?
Absolutely, and you're so correct that this is one of the biggest changes. In fact, I say it's a complete game changer. The covered entities, the security and privacy rule, many of the things have been in place. The audit criteria from OCR, the Office of Civil Rights, has been out for over a year, and most organizations have begun some program of continuous maturity in trying to become HIPAA compliant. The challenge now is that today business associates are required to comply with all of the same requirements of the security and privacy rule. And they are required now by law to have to notify the covered entity of any potential breaches. This is especially important because now under the Omnibus rule, breaches are presumed to have happened unless you have a risk analysis and an investigation that proves that it didn't. So the challenge for business associates, vendors, who have never had to have the kind of strict security in their own internal processes, who don't even have documented policies and procedures, that's one of the biggest challenges. It also includes all of their subcontractors, and I get calls constantly asking about subcontractor relationships with business associates and who's responsible for them. And I'm not an attorney and I'm not giving legal advice, but I always come back to say my assumption is the deepest pockets. The other thing is that whether or not there is a business associate agreement in place, the business associate is now still liable, and they are subject to the same audits from OCR. And unless you contractually obligate them to tell you that OCR is investigating them through your business associate agreement, you may not even know that there's an investigation on your organization that's happening through one of your business associates. So it's really time to tighten up on the business associate compliance and the business associate agreements.
Now, does that mean that the business associate agreement that we're all familiar with covers all of these components, or do the covered entities need to go a step further in terms of making sure that the business associate is complying with all these changes?
Well, that's kind of a loaded question. Number one, most covered entities are going to or have already begun to change their business associate agreements to reflect the changes that are in the Omnibus rule. The Omnibus rule clearly states that the covered entity is responsible for assuring the compliance of the business associates, and if the business associate is not in compliance and fails to come into compliance, you must terminate the contract. So in organizations where there's been a very long relationship with a particular vendor, especially if they perform a mission-critical function or service for you, and they refuse to sign your new business agreement, or they are not compliant, this can have an incredible amount of business process impact changes and a lot of risk management decisions that need to be made around those business associates now.
Okay. And Angie, I'm just going to mention very quickly for the audience, you have a little bit of an echo. I don't know if you can mute one of your computers if they need to be. But moving forward, is this then something where we know that the Omnibus rule changes in terms of enforcement are taking place for covered entities on September 23rd? Is it the same then for the business associates? Do we have to hold them accountable to that date? Hello? Angie?
Are you there?
Yes, we can hear you now. Go ahead.
Okay, I'm so sorry. I was trying to figure out the mute problem.
Go ahead.
So as of March 23rd, the covered entities needed to comply as of, and the enforcement will begin by the Office of Civil Rights. For business associates, there is from the 23rd until the September 23rd of 2014, and in 2014, OCR will begin auditing and enforcing HIPAA requirements for
Goodbye.
Hello? Okay, I'm going to keep moving forward. We've lost Angie. I'm sorry, we're experiencing some technical difficulty. One of the components that Angie was getting into is that a business associate has until next year to really get all of this in place. In terms of your agreement with your business associate, however, you may want to move forward in ensuring that they have the information or dotting their I's and crossing their T's now, and not necessarily waiting until next year, 2014, to ensure that, because there is some liability in terms of both parties. And in terms of breach notification, there are also some major changes coming forth with the Omnibus rule. And one of the things that is a big impact is that right now it used to be that we would determine really what is reportable. The best rule right now is to assume that anything is reportable. So you want to presume that, and you want to do a risk analysis to validate determination. So in regards to looking at what happens in terms of a breach and whether you have to notify or not, a risk analysis really helps you to determine that notification. So you have to look at who was impacted, what process is in place, the numbers, and that without a risk analysis in place, you really can't do that. So that is a core component of ensuring that you have really done your due diligence in terms of a breach notification. There certainly have been a lot of privacy updates within the Omnibus rule. And one of the things that I want to talk about in terms of both breach notification and privacy updates is whether a company should consider having a partner that helps them with breach notification. And that is so important because there's a lot to breach notification if you have had a breach. So it's not just sending out letters, notifying those impacted, but when you think about workflow, and we want to go back to that workflow process, particularly if you are a provider organization. You need to think about things like, do you want your front desk person answering calls concerning a breach notification that you sent out? Or will that impact your workflow? It might be better to have a partner or to have another process in place to handle the calls that would come in at the time that you have a breach notification. So that is certainly an important part of making sure that you've dotted your I's and crossed your T's. Certainly you have to make sure that you've amended your notice of privacy practices and that this is not required in terms of the Omnibus rule, but it may be a good practice that when your patients or your members are going through to point out the changes, just in good business practice. There are also certain disclosures that now have to take place for those of us that are working with a health plan or that are providers. Physicians can no longer disclose information about care that the patient has paid for out of pocket. So that's a change in your business process that you have to make sure that you've addressed. And it also requires those of you who are providers to abide by any patient's request not to disclose the protected health information to any health plan for those services that they have paid for out of pocket. So that is something that obviously impacts all of our workflow. There's also impacts in documentation and your follow-up. Angie, I'm really glad you were able to get back in. Would you like to add in terms of the privacy update?
Yes. I think that one of the most important things to stress about the Omnibus rule is that patients have the right to keep their medical records private when they're paying out of pocket. And again, when we talk about the impact on workflow and data processing, we need to make sure that we have ways to flag or tag or designate those treatments where the patient is paying out of pocket so that their medical information is not inadvertently released to a payer or released in some other way.
Excellent. Can you talk also in terms of breach notification? What do you feel is the most significant impact that providers, payers, and other professionals will feel?
I think one of the most significant impacts is that because of the ability prior to Omnibus to be more subjective about whether or not something was actually a breach, there will be more breaches reported now. The other thing will be that having a partner to help you through the breach notification process is critical, because during a data breach, people will be panicked, people will be upset. Their medical identity is very important to them and it is very valuable. And during the time that you're trying to take care of patients, have them talking with nurses, you do not want to also have to have angry or frightened patients on the telephone tying up phone lines. So having a website to talk about the breach, having a call center that the patients can call into to get information, and also understanding that we also need to be cognizant of state data breach law notification because in over 45 states now, it is a state requirement. So it's not just about our patients, it's also about our employees. And we have to, should we lose their social security numbers or other identity, we have to make notification in accordance with state law as well.
Okay. You mention a lot when you're doing consulting the tell, prove, show formula.
Yes.
Can you talk a little bit about that in terms of privacy updates?
Absolutely. When I talk with people and I ask about a specific thing, and I will say, tell me about your business associate agreement compliance. And they will say, oh, we have that covered. We have the we have our business associates sign the contract. And the next step I will say is, well, show those to me. And they show me, sometimes a big folder, sometimes they're online. And then I say, prove to me this, what you've given me documents every business associate you have. They don't have any way to prove to me that the folder of forms that I have match the actual number of business associates that they have. And it is remarkable how many times in larger organizations those business associates can fall through the cracks. So in every single requirement of HIPAA, I want to make my clients tell me what they do, show it to me, and then prove to me that they follow it, because that is exactly what an OCR auditor will do when they come to visit. It won't be enough just to say we have it, and it won't be enough just to show it. You absolutely positively will have to prove how you follow it and that you comply.
So an audit is a big component of that proving component, is to do a self-audit or to go through that audit process before you actually are audited.
Well, the biggest finding in the OCR pilot program last year was failure to have performed a risk assessment. It is a requirement of HIPAA that you perform a risk assessment, because the logic, which is very sound, is that you can't possibly have a good security and privacy posture in your organization unless you've made a conscious effort to determine your risks. And too often, various areas are operating in silos where, take for encryption, for example, someone says, well, HIPAA requires you have to have encryption on your mobile devices. Well, yes, if they have PHI. If your assumption or your position is that we don't allow PHI on mobile units, and you allow those mobile units out into the wild with your staff, and your staff is able to save PHI onto those laptops, then there was no risk assessment to determine that what you say you do and what you can show with a policy was actually definitively documented as having been done. So that's where in the audit you really want to be sure, again, that you can prove what you say you do.
Okay, makes sense. One of the components that we run into a lot is the different technology systems that are out and involved in healthcare today. Certainly we deal with providers that use electronic health records, electronic medical record systems. Does the Omnibus rule impact those technology tools? Are they always considered a business associate?
Well, that depends, because it all comes down to where does the EPHI live. If this data lives in the cloud, then the cloud provider is absolutely a business associate. However, if the data lives in your practice on a server, then the people who provided you that server are not business associates, although the company that may do maintenance on it would be. The assumption is that, not the assumption, but the definition is anyone who processes, stores, transmits, or otherwise has access to the EPHI or PHI is a business associate. Now, there is the conduit exception. However, the conduit exception is very, very specific in that it is, in the case of hard copy documents, it would be the U.S. Postal Service, it would be FedEx, UPS. In the case of electronically stored health information, that would be your internet service provider, the folks that are providing the wire and they can't access that information. Now, cloud providers, unless they have very, very, very specific security requirements in place, they will not meet the conduit exception. So there are technology solutions that are in development right now, double-blind encryption and some different things for cloud providers to be able to truly be in the healthcare technology space. But you really need to understand where your data lives. I would also caution people that before they sign up for a cloud service, that they actually are contracting with the actual company that hosts the data, because there are an awful lot of reseller and subcontractor agreements out there. You really want to deal directly with the organization where your data is going to live.
Okay, so in terms of even email that would be hosted in a cloud, that they would be a business associate possibly for an organization?
Yes.
Okay.
Yes.
So enforcement is a big change. It's obviously something that we are all concerned about, and we need to understand how it will be changing. Can you talk a little bit about the enforcement and the steps that you walk an organization through to make sure that they comply, so that they really don't have to spend the time worrying about enforcement?
Absolutely. There are a few big areas to remember around enforcement. First of all, to understand that when the American Reinvestment and Recovery Act came out, it gave the state attorneys general the ability to enforce HIPAA. So it's no longer just the Office of Civil Rights that may knock on your door. Also, the state attorneys general, as well as the Office for Civil Rights, get to keep the monetary penalties and fines for more enforcement. So it's almost a self-funding program, so to speak. And then the third and final thing is the whistleblower provisions. Having patients or having disgruntled employees call is going to become an even bigger way that you end up with an OCR audit, because with the whistleblowers, there are times and ways, depending on situations, that they may also get a cut of the penalties and fines. So that's how you will pop up on the radar. So the people out there who've been saying, well, they'll never worry about us, we're too small. Well, that has completely come to an end, and OCR has in fact tried to make examples of small practices recently, like Hospice of Northern Idaho and Cardiology Associates of Phoenix. So what are the top 3 things that you can do at the end of this phone call that you need to take a look at? First is you've got to perform a risk assessment on your organization. It is required, it's the #1 finding, and it is getting to a point where it is just simply not tolerated. There is no excuse not to have performed a risk assessment, and to perform it at least annually, and then anytime you introduce change into your organization. The second 2 things I think are huge, because 60% of all medical records breached have been breached directly due to business associate problems. The business associate was directly responsible for the incident. So I always tell organizations, if you could pick one thing and reduce your risk by 60%, why not focus on that area? So that area is focusing on your business associates, risk rank them, and then take your highest risk business associates and begin a formal audit program on them and make them give you assurance, make them prove to you that they are in fact compliant. And the last thing is around unencrypted mobile devices and media. If you still have unencrypted mobile devices in your organization, I can tell you that you are a ticking time bomb. USB devices, backup tapes, laptops, iPads, phones. OCR has 0 tolerance for lost unencrypted devices. Encryption is inexpensive. Encryption is easy to do, and it is just absolutely crucial that you have it in place and that you are using it, and yet you can prove that your users are using it. So those are the big three.
Wonderful. Thank you for the information. There are other requirements that organizations need to be aware of, and I think the biggest advice in terms of this is to make sure that when you're doing training and you're going through all of the requirements, you just have a checklist to make sure that you're addressing it. And depending on your organization, it may not be quite as important as it would be to a provider, for example. Some of those things are you can't use data for marketing and fundraising. You can't use genetic information for underwriting. That is a core part of training and making sure that your documents are in place and that you're complying in terms of your patients and your members. Janellen, I'd love to bring you in for a moment to talk about, the fact that yes, training is important and it should be a core part of how you are addressing the Omnibus rule. You want to make sure that it's being implemented not just within your business, but within your business associates organization. But Janelle, within training, there are things that we need to be concerned about and aware of as well. Could you speak to that a little bit?
Sure, I'm happy to. And again, thanks for having me. We have an education-based model in Brad's site, and we encourage our providers to take advantage of educational opportunities and to train their staff on the policies that they have, including HIPAA. And then on the other side of it, I certainly train my staff on a regular basis and on HIPAA and our processes and things that we use and a lot of that technology. And one of the concerns that has come up is the use of training material. It's very tempting to make a screenshot, for example, of a screen. It could be a scheduling system or any tools involved in the industry, and using that material for training purposes, or even logging onto a system for training. I think it's really important that we're mindful of using a test environment or blanking out that data. Angie, would that be part of the risk assessment, is looking at training processes and materials?
Absolutely, absolutely. And you're looking at it not only from the privacy standpoint, but what I see most often forgotten is training around specifically the security rule with the IT staff.
So there's training about preparing training, in a way.
Absolutely. I guess you could say that there's training about training.
Yes.
I think that often organizations get very caught up in training around the privacy rule, and that is absolutely very important. But most of the incidents that we see on the OCR wall of shame are not necessarily inappropriate access by the practitioners. Most of what we see are poor technology practices, poor risk management around business associates, and poor business associate vendor assurance.
Mm-hmm. That's a great segue into the next slide. We want to switch gears for just a moment and focus on radiology and really focus on our providers. And you just said this, 60% of data breaches come from the business associate. And that impacts every part of healthcare, and it certainly impacts radiology. The one thing to remember is that these are what I like to call non-malicious issues or non-malicious events. They can be things like we have the policies in place, we've trained everybody, something happens, it doesn't get to the right person, so we don't really enforce it. And it can even be a lack of understanding. And this happens in every branch of healthcare. Dr. Reiner, I'd like to bring you in for just a minute with your expertise in radiology to talk about some of the things that you see in terms of data access and telemedicine that could potentially be a focus with the Omnibus rule changes.
Okay, I'd be happy to. In my other life outside of RadSite, I work as a teleradiologist. And while it's an expanding and exciting field, it really leaves the individual practitioner out on an island. When I first started doing teleradiology about 7 years ago, the company I worked with, I was probably one of about 30 or 40 teleradiologists. And as you can imagine, we're all individual nodes on a network. We're all practicing in relative isolation. And the primary way in which we communicate with one another is electronically. And one of the things that telemedicine providers and teleradiology providers in particular want to facilitate is a lot of interaction and consultation between the radiologists. You know, if I'm a general radiologist and I'm looking at a difficult brain MRI study, it's great that I can ask another teleradiologist who has neurospecialty training to look at an MRI of the brain. And that's constantly being done. The problem is, a lot of times the people I consult with, I don't know whether they have the appropriate privileges in that state, the licensing, and in that hospital to review that image. So in a very naive and well-meaning way, we're constantly consulting with one another over difficult cases, asking for second opinions, and we're sharing information that legally we're not allowed to share. And that happens all the time. The same thing happens when we're doing independent research. When we're looking at the database and we're extracting information, we don't always have the authorization of the individual patients or the individual facilities that we're sharing data with. So it's really very much of a minefield. Although our intent is well-meaning, in reality, oftentimes in everyday practice, we're kind of violating the standards that are set. And it particularly exposes me as a teleradiologist because I'm a subcontractor, I'm a business associate, and I have to rely entirely on the parent organization, the covered entity, to look out for my well-being. And I mentioned earlier that there were 30 or 40 radiologists when I first started practicing. Now there's literally over 400 radiologists practicing teleradiology within the covered entity I work with. So you can imagine that we are completely isolated entities. We're completely dependent upon the parent company to guide us, not only in terms of being compliant with the rules and regulations, but also with the technology we use every day and the data that we're accessing. So it's really a frightening proposition for me as a teleradiologist to be able to make sure that I'm abiding by the rules, the company I'm working for is completely compliant, and more importantly, educating me as to what I need to do in order to basically be compliant with the new rules and regulations. So there's a lot on everyone's plate, and I think that the interesting thing is very few people, myself included, really have a full and complete understanding of the new rules and all the potential penalties associated with those.
Interesting. They're very interesting scenarios. Angie, I'd like to bring you back in for a moment just to comment on, you know, these few scenarios that Dr. Reiner has shared, and also to give some final thoughts on the Omnibus rule before we open it up for questions from the audience. And for the audience, if you want to chat over some questions, I do have a couple that came in. We are going to spend some time on Q&A as well.
Dr. Reiner, yes. Dr. Reiner's points are absolutely excellent. And, you know, it's really important to understand that everybody working in healthcare is there to take care of patients and help people. And the technology facilitates us to do that. And the collection of data is going to be tremendous for healthcare. But there are a lot of bumps in the road right now. And in terms of your business associates, this is one of the reasons why it is so very important to risk rank them. Risk ranking with your business associates would be to find out if your business associate is using telemedicine or are using nurses that possibly work from home computers. Those are risk areas because we don't know in every one of these companies if people are using their own computers or they're using computers supplied by the business associate. And we don't know what those security practices may be. So his points are excellent. The other area of high risk, unfortunately, are small businesses. Small businesses don't tend to have the same kinds of resources as the very large ones. And too often when I talk to organizations, covered entities, they think the highest risk are the great big contractors they work with, such as a Siemens or a McKesson or GE. And in actuality, they are lower risk because they've been dealing with HIPAA and they've been dealing with security and privacy for so very long and have incredibly competent IT security people to keep everything going. So we really need to look at the small business associates. I think the final thought that I have is this truly can seem overwhelming, but the three basic fundamental things that I talked about: perform a risk assessment, evaluate your business associates and make sure that they are in compliance, and if you don't do anything from this call today except encrypt your mobile devices, then my time on this call will have been incredibly well served, because that is a huge risk area. Start with the big three, and you will be well on your way to a risk-based approach to being compliant.
Excellent advice. We do have some questions that I'd like to get to. One of them is, where do you file a breach, or how has that changed?
You simply go to the Office of Civil Rights, Health and Human Services website, and you will find two simple links. One is to report a breach of more than 500 records, and the other is to report a breach of less than 500.
And is that different? I think it was Dr. Reiner that mentioned the state that you live in. Could there be additional things that you need to do based on the state, or is it all based on that?
In terms of electronic health information, HIPAA trumps state data breach laws. But as it relates to financial information, credit card information, all of that is determined by the state in which the patient or the employee lives in, not the state in which you exist as a business entity. So when it comes to state data breach notification and breaches around financial or credit card information, absolutely positively turn to experienced legal counsel in the world of privacy.
Okay. Moving on to another question. Is compliance the same for a health plan, a network, a provider, a broker? In other words, in terms of the Omnibus rule, does it apply to everybody dealing with PHI, or is it specifically for healthcare providers?
I tell everyone that if they're questioning whether or not HIPAA applies to them, it probably does. The ultimate goal of the Office of Civil Rights, in my opinion, is that by 2015 or thereabout, anyone who handles health information will be subject to it. If you're not sure if you're subject to HIPAA, absolutely work with an attorney who has experience in HIPAA. Let me also say this, especially about the security rule. HIPAA requirements around the security rule for your technology, it is just an excellent group of best practices that you should be doing anyway if you want to have secure information in your organization. It's based on standards that are written from the National Institutes for Standards and Technology, and even if you were running a small business that wasn't even in healthcare, the requirements of the security rule would absolutely fit into a very good security program.
Okay. We have two more questions. One I think you have already answered, so I'm going to go to the last one. In terms of a breach, are there more penalties or more of a liability if the breach was actually caused by the business associate, on the business associate, or is it equal on the covered entity in terms of fines, liabilities?
Well, because this is new, we really don't have any cases yet to know how it's going to be interpreted. I can tell you that the assumption will be that you chose the business associate. So if their incident that caused the breach was through poor policies, poor training, lack of a risk assessment, lack of encryption, then that most definitely will be viewed as poor risk management on the part of the covered entity. Ultimately, the breach notification responsibility still lies with the covered entity. It's your data, your patient's data, and you are the people that will need to make the perform the breach notification. Now, it's incredibly important to understand that right now there are a lot of cyber liability policies that will cover data breach investigation, which can be incredibly expensive just to even determine if you've had a breach, things like forensics and legal services. But understand that I am not aware yet of any insurance policy for cyber liability that will protect you from the fines and the penalties, and certainly no insurance is going to protect you from jail time should there really be willful neglect.
Okay. What I want to do at this point is I don't see any other questions coming in, but I want to talk a little bit about available follow-up. And I want to, first of all, thank the panelists and thank the audience both, because we had some unexpected technical difficulties. There's a lot of information with regards to the Omnibus rule. We will be sending out an announcement and some follow-up information. We had a higher than expected number of attendees, so if you have a colleague who is trying to log in, some of them could not log in. So we'll be recording the webinar and making it available to them, and possibly doing an additional follow-up webinar because of the technical difficulties that we had. But in terms of our specific follow-up, we do have available, and we'll be following up with each of the attendees today, a free self-assessment. Now that self-assessment is going to take you through some of the categories that we talked about today and really give you a strong feel for where you stand in terms of your current responses to these questions. We also suggest that you reach out right now from any of your current IT partners, different quality partners that you have, to see what tools are available to help you. And we certainly are here as a resource as well. Angie and the other panelists, I really appreciate your time today. Are there any closing comments that you would like to make before we end the call today?
I would just say about the self-assessment, one of the most important things about the self-assessment is that it will specifically cite the areas of HIPAA that will give you direct information about why you need to have a certain thing. So it's not just simply, yes, I have it, or no, I don't, and you get to the bottom and, oh my gosh, I don't have anything, what do I do? It gives you the direction that you need. And the last thing I would say is, as you're looking for assistance, make sure that you are working with professionals who truly have HIPAA experience, because this is an emerging area, and it really can be problematic if you're not working with partners that are entrenched in HIPAA and regulatory compliance.
Thank you, Angie. Again, I want to thank Janelle Neese and Dr. Reiner for taking the time to give some of your insights and for helping us to prepare the webinar. The follow-up email that goes out will have the contact information available for you to get the assessment and to ask any follow-up questions that may be coming in that I'm not able to view. We appreciate your time, and we certainly are here to help you, and hope that all of you have a wonderful afternoon. Thank you so much.